this is the Kickstart series where we reverse the role play, and I'm going to be the exam candidate, and I've got Dr. Priyadarshini, who will kindly be my role player for the station that we're doing, which is from the Subfertility module, discussing same-sex couple and in the context of requiring surrogacy as part of their treatment. So we'll do it exactly like how we do in the exam, 2 minutes of reading time. But because here I'm a candidate, I'm going to also tell you when you are a candidate and when you read the instructions, how should you read it and what should you do in those 2 minutes and how to use those 2 minutes effectively. So this is the station. As soon as I go in, the first thing my eyes will start looking for is try to see whether it's a structured discussion or is it a simulated patient task. So in this page, I can't really make out from it. So I'll go into it and see who are my patients and what am I dealing with. So I can see there are two names, Mr. Robert and Mr. Sean, which tells me that there are both men and they are a couple, which means I'm dealing with a same-sex couple. Next, I will see they've explored a few options abroad, which means that they probably already have a rough idea about what are the options available. So today, I won't have to start from the scratch, but I might have to add up to their existing knowledge. Then it says the Tim's couple have been waiting 8 months for this appointment. So I am going to prime myself and see that probably I'm going to already be dealing with somebody that is slightly frustrated. They might already be kind of fed up of the 8-month wait. That's the reason they might have gone abroad to explore other options. So I'm trying to build my knowledge about this couple and make a plan as to how I'm going to deal with them. Of course, this is a very brief history that I've been given. So the next task, it tells me take a detailed history. So I'll have to take a detailed history here. Address their concerns and discuss the options with them. So automatically in my head, I have to start making a plan. I have to discuss the options, which means I should know what are the options I'm going to give them. And that might change based on the history I take from them. And whatever questions they might have, I have to address those. So that's what I'm going to prepare in those 2 minutes. I obviously won't be able to make a note of what I'm going to do, but this is how I'm going to look at the question and assess it. In the next page, I'm going to see what kind of task it is. It tells me it's a simulated patient task. So I know I'm going to be faced with a role player and there is going to be an examiner who's going to be on the fly on the wall assessing me. So I'm going to be marked here on communication with patients. So I know I'm directly talking to the role player. It says information gathering, which I already knew before because it said take a detailed history, patient safety, and applied clinical knowledge, which means I need to know about the fertility options for a same-sex couple. So that I think is my 2 minutes. So let's start the 10 minutes timer. I'm just going to time myself for this case. And then at the end, we'll just discuss about what was left behind and what could have been added to the case at the end of the 10 minutes. So let me start the timer. Right. Hello, my name is Meghna. I'm one of the doctors in the fertility clinic. And you must be Mr. Robert.
Yeah, you're right. I'm Robert.
Please, can you confirm your age for me?
I'm 45.
Okay. What would you like me to call you?
Well, Robert is fine.
Okay, pleased to meet you, Robert. My name is Meghna, and you may call me that. So, Robert, firstly, I'm so sorry that you've had to wait 8 months to see us in this appointment. How do you feel about that?
Well, don't ask me. It was a very, very tough decision for us to, keep us waiting for such a long time. We, as a couple, were prepared a long time back to have our own child. And sometimes I just feel it's totally unfair to keep people waiting for such a long time. We really had to go outside, look abroad for all the options that we could, just be parents sooner.
Yeah, of course, I know it can be quite frustrating when things are not on your hand, but I reassure you that we'll try to make the most of today and see how we can best help you. Have you got any idea? Have you explored the options already?
Well, thank you for all your concerns. I just do understand that there are some, options with NHS which I can explore, and we as a couple can look into that. But well, I'm not very sure of all the minor details that I really need to look into. As of
Sure.
now, Sean is open, and both of us have decided to have the baby, but we're yet to make further decisions and clarifications on the same.
Sure. So, what I'd like to do today, Robert, if you agree, is get to know you both a little better. And is Sean okay for us to discuss about him in his
Yeah, yeah.
absence?
He has consented. He has
Oh,
consented. He's busy at work, so I'm
sure.
here representing both of us.
Okay, so we'll get to know you both a little better and we'll talk about the options. And at any point, if you want to ask me questions, please feel free to do that. And I'll also give you a lot of information to take home so that both you and Sean can go through that. So I'll give you information about surrogacy, I'll give you information about donor egg, and also all the support that's available to you. Okay,
Well, that sounds
so
good.
yeah. Have you got children already, both of you?
Mm. No, never.
No. And any health problems that you've got, Robert?
Well, I did have little problem with my breathing. It's probably I was smoking a lot in the past, and
Okay.
now things are under control, and I'm not on any drugs.
Okay, that's good. And have you given up completely?
Yes, I've completely
That's
given on that.
excellent. And any health problems for Sean?
No, he's fit.
Okay. Any operations you've both had?
No, nothing. Not that I have know of Sean also. He's been doing good all well.
Okay, great. And any allergies for both of you?
No, nothing. Both of us are
No.
fine.
Any conditions that run in your family that you're aware of, Robert?
Well, nothing is there in my family, but I do
Mm.
have a little bit of information about Sean because, I think there's a history of cystic fibrosis that is running in his family.
Okay, I see.
He
Who
has
has
a
got it?
brother. He has a brother. I think he is probably diagnosed with cystic fibrosis. Yep.
Right. Okay, so that's quite important information that you've given me. Thank you for letting me know.
Mhm.
Do you know
Okay.
if Sean has been tested for it?
Well, I'm not very sure about it. I think he has something in his childhood, but I do not have any evidence or reports with me.
That's fine. That's something that we'll have to test for, mainly because this is a condition. If there's a single copy of that abnormal gene of cystic fibrosis, then a person
Mhm.
will not be affected by it, which clearly Sean
Okay.
doesn't have. But if he carries
Okay.
the gene, it means that he can pass it on to any children that he might
Oh,
bear, and
really?
reason why we have to test for it, okay?
Okay. Okay.
And
Fine.
any
We'll look into
donor that
that.
we use, we always
Mm-hmm.
test the donor for it.
Hmm. Okay.
Okay.
Okay. That's good. Mm-hmm.
Last few questions about both your lifestyles, if I may.
Sure. Sure. Go ahead.
What do you do for work, Robert?
Well, I'm an engineer.
And what
I work
about?
with one of the top firms here, and we are doing good. And Sean is a teacher.
Okay. And do you feel like you're ready, both financially, support-wise, to start this journey?
Of course, we are. We really do are. We given a lot of thought process before we could go ahead. And, for the past 1 year almost, we've been making decisions and we are completely ready now.
That's great. And you don't feel any kind of anxiety, and sometimes this can be quite, it can bring on certain mental health issues. Has that been the case for both of you?
Yeah, initially to start on, we did have, queries. We were not very sure of, whether we are going in the right direction. But then we did go through a lot of information and we were looking at on Google also. And right now, I think we are mentally prepared for it. Yes, we are
That's
okay.
great. Okay. And you mentioned that you've quit smoking. That's excellent. What about Sean?
Yeah, he's fit. He's not got any habits and he's absolutely fine.
That's great. Both of you take any alcohol?
And no, never.
Okay. And pardon me for asking, any recreational drug use in the past?
It was quite some time back, but nothing of in the recent present.
Okay, that's great. And last few medical checklist questions. Do you know what your blood
Yes.
group is?
Well, I think I'm A plus.
And what about Sean?
He's B plus.
Okay. And you've both been vaccinated.
Yes, we are.
Okay, great. So thank you for sharing all of that information. Do you know if there's anybody in your family or your friends that would be surrogates to you for the treatment?
Well, my sister is interested. She wants to give her eggs for the same, and we are
Right.
happy. Even Son is okay to accept that.
Okay, that's great. So, talking to you about the options now, and I said I'll give you information to take home as well because there's lots to talk about. So, there are
Mhm.
two types of surrogacy. One is called a direct surrogate. That is when the same lady provides her womb for the pregnancy
Okay.
as well as the eggs in treatment. And if your sister wishes to provide the eggs, that is an option. However, Robert, we won't be able to use your sperm in such case, okay, because you will both be
I
siblings
see.
and we'll
Oh,
be
yeah,
her
yeah.
egg and your sperm. But
Okay.
direct surrogacy, again, can be done in two ways. One is called
Mm-hmm.
an IUI, and this is when
Okay.
it's a simpler process where at the time that the lady ovulates, we
Okay.
would time that with inserting the processed sperm into the womb. And
Okay.
this can be done either in a natural cycle if she's got regular cycles, or we might have to give some medications to bring on the ovulation. Okay. And the success rate per cycle is about 10 to 15% per cycle. And usually one might require more than one cycle for the pregnancy. And generally, after 6 cycles, 3 out of 4 would have a pregnancy.
Okay. But how long do I need to wait for this?
So usually if you were to go, there is a waiting list for you to go ahead with treatment, but we will be taking on other parts of the treatment at that time, which will be to start the investigations for the donor, which is to check not only for infections, but also to check for genetic conditions to make sure that we are not using any sort of eggs where there could be a potential inheritable problem. Okay.
All right. That sounds good. Mm-hmm.
The other option is IVF, and this is slightly more complex. And this would be when we would take the eggs directly. So we give the lady some medications to grow all the eggs in her ovary. We take it out of the ovaries and we process it in the lab and we fertilize it with the sperm in the lab. So if we were to use your sister's eggs, we would then be okay to use Sean's sperm. Of course, we will get you both to have sperm tests to see the quality, and we can take decisions further based on that as well.
Okay. All right. But what about the condition, that's running in Sean's family?
So we will have to test Sean for it. And if he's a carrier, we have to ensure that your sister is not a carrier as well, because if both of them have the carrier gene, then there is a 1 in 4 chance that the baby can have it. And that's not something that would be ideal. Okay.
Yeah, exactly. Yes. Mm-hmm.
Yeah. So when we talk about IVF, the success rate per cycle is about 1 in 3. And the benefit of that is if we have created more than one embryo, which is the fertilized egg, we're able to freeze those. And the advantage of freezing is that we will be able to use it in a subsequent cycle if the first one is not successful. Okay.
Okay. Okay.
There's a
Mm-hmm.
second type of surrogacy, which is called a gestational surrogate. And a gestational surrogate is when the egg provider is a different person or an egg donor, and the gestational surrogate only carries the pregnancy.
Okay. All right. So, like my sister gives it and somebody else takes the baby, right?
Exactly, you're right.
Okay. Okay.
So
Yeah.
what we can do is, if you were going down this route, we'll have to put you in touch with an implication counselor. So these are counselors who will talk to you about the legal aspects and the psychological aspect of having donor treatment.
Mm-hmm.
We could also advise you to have your own independent legal advisor, because these are processes where you need to have enough information legally as to what it means to have a surrogate. And third thing is that I will have to arrange another appointment with my consultant for you so that we can discuss more in depth about these processes. And what I'll do today is give you the costing sheet, because I must inform you that these treatments are not on the NHS. So you'll have to self-fund the treatment. So I'll give you
Mm-hmm.
some costing sheet. And what I would advise is in the next appointment, I would like you both to come along so that we can discuss the options further.
Yeah, yeah, sure. That was a very nice consultation, and it's great that you've given me all the details required. I will definitely look into this. Yes.
Okay, sure. Okay, thank you. So I think we've completed 10 minutes station. So as you can see, what happens in a 10-minute station is that you're not going to be covering every aspect of the treatment. We have spoken briefly about just the surrogacies. We've briefly spoken about donor, and we've only briefly just picked up on the history points, which was that there was cystic fibrosis in Sean, and we were cautious enough to screen for that. And we picked up that the sister wanted to be the egg donor. So we picked up that that Robert could not be the sperm provider because they would then be siblings. So that's the 10-minute mark now. So the reason I ended the consultation without going further into explaining more about gestational, just what the surrogacy is, parental order transfer, and all of that is because I knew that I was not going to have enough time to do that. And if I went into that, I would probably get cut in the middle of my sentence. So what I did was I said, I will organize an appointment with the implications counselor who will tell you about all of the psychological aspects and the legal aspects of being in this kind of a treatment. I will advise you to have an independent legal advisor who will advise you regarding the legal aspects of surrogacy. And I said, I'll organize another appointment with a consultant. And I said, it's important that Sean is also there in that consultation so that we can take further decisions. And at the end, I mentioned that they need to know about the cost involved and that it's not on the NHS. So that's where the consultation ended. So Priyadarshini, I would wait for you to give me your inputs as well.
Yeah. So it was a very well done station. Now, for a same-sex couple, the first thing that they actually expect is they do not know in depth how much ever they read. So they just want an overline of, what else they have ahead before them. And you had beautifully explained everything in a, in a very, very natural way, not using a lot of jargons, in a very well explained way. And you did check of my understanding also. And it was good.
Yeah. So that's what, what happens is when you start reading the theoretical aspects, you feel like there is so much to cover. And indeed, there is so much to cover. But 10 minutes is a short time. You won't be able to go into all of it. So you will see that even though we've been doing this for so many years, I obviously will not be able to cover the parental order, parental responsibility, what every aspect of it, because there are other elements in this case where it's talking about cystic fibrosis. And I didn't say that if cystic fibrosis is there, we will offer PGTA, because that is going to open another Pandora's box there. So I don't want to unnecessarily put myself in trouble by saying, if that is the case, we'll do PGTA. I just use the easier method, which is we can use, if Sean and the sister both have, then we can think about changing one of the gamete providers rather than dig myself into doing another PGTM. And in the beginning, I apologized for the wait, because what happens is whenever someone has been waiting, you suspect that this might become an angry station. This might become a frustration venting out station. So I tried to calm them down from the beginning by saying, I'm sorry that you had to wait for this appointment. That allowed them to open up and tell me a little bit about what was their journey so far. And then, of course, the history, I ensured that I have got the consent from the partner, so that comes into the patient safety category. And then I spoke about each of their histories. I took it simultaneously to save a little bit of time. And then I went into the brief outline of direct surrogate and gestational surrogate. Obviously, I couldn't cover more of the donor egg, but that's why I said these are the things and signposted them where they can go to have further information. So I hope this helped you all, and we'll come up with more of these stations and we'll discuss these in your sessions as well. Thank you so much, Dr. Priyadarshini, for being my role player.